Okay, welcome back dear friends. I am Dr. Klim Raza. Today in this video lecture we are going to discuss about GIT cells and what are the important secretions produced from these cells, and what is basically the concept of the pernicious anemia, and what is NSAID induced gastritis of the peptic ulcer. So first cell here is your surface cells, number one, and surface cells produced a mucus which is rich in HCO3, and this mucus is basically required to neutralize acidity of GIT. And then number two, you have got chief cells, and function of these chief cells is to produce pepsinogen, and this pepsinogen help in digestion of proteins. Then number three, you have got very important, the parietal cells, and the parietal cells help in production of gastric acid, HCl production, and also the parietal cells help in production of the intrinsic factors. So purpose of this intrinsic factor is the absorption of vitamin B12, especially from terminal ileum. So parietal cells produced help in production of gastric acid, and in addition the intrinsic factors, and intrinsic factors help in absorption of vitamin B12 from terminal ileum. Then next, another cell that we have got G cells, and the G cells help in production of the gastrin. And then last one, you have got enterochromaffin cells, which help in production of histamine, So among these, the most important and clinical significant is the significance of the parietal cells. Why? Because parietal cell function is absorption of the vitamin B12 from terminal ileum with the production of the intrinsic factors. So in case of gastric carcinoma or in case of any autoimmune disease that lead to the destruction of the parietal cells of the stomach, ultimately you will have deficiency of the vitamin B12. So that is called as pernicious anemia. So what is pernicious anemia? That pernicious anemia, deficiency of vitamin B12, and why there is deficiency? Because there is no absorption from the terminal ileum. And why no absorption? Because of destruction of parietal cells of stomach, and because these parietal cells help in production of the intrinsic factor, and then intrinsic factor in turn help in absorption of the vitamin B12 from terminal ileum. So if anyone is having gastric carcinoma or any autoimmune disease where there will be destruction of the parietal cells, secondary you will have pernicious anemia, deficiency of the vitamin B12. And it's also common in colorectal carcinoma also, especially when you are having some ileum disorders also, because all these micronutrients are absorbed from the terminal ileum. Then next, what are the factors which increase the gastric acid secretions? Factors increase acid secretion. Number 1, you have gastrin. Gastrin will increase the acid secretion, and also the histamine. But you know, the secretion, gastric acid secretion is basically inhibited by prostaglandins. So potent inhibitor. So potent inhibitor, you can write potent inhibitor of gastric acid secretion is your prostaglandins. And when you are taking, you know, non-steroidal anti-inflammatory drugs, when you will take non-steroidal anti-inflammatory drugs, especially the most commonly abused is your paracetamol or the aspirin, or if someone is having any chronic pain like arthritis, you are consuming, you know, painkillers, non-steroidal anti-inflammatory drugs. So these drugs will inhibit the prostaglandins, and this prostaglandin is the protective layer of GIT, especially the stomach, because which help in, you know, decrease production of the acid in your GIT mucosa. And when you are consuming too much NSAIDs, it means you will have, you know, deficiency of the prostaglandins in your body, destruction of the PG cells. So destruction of the PGs, more acid will be secreted, and that acid is dangerous, and that lead to peptic ulcer. Peptic ulcer. So most common cause of the peptic ulcer is the drug induced peptic ulcer. And what is the mechanism? This is what just I have, you know, described here, that NSAIDs basically they will block the prostaglandins and function of the prostaglandin. That's why this is called as protective layer of the GI mucosa, because they inhibit the acid secretion. So again we will recall that cells, like first you have to understand the function of the surface cell, chief cell, then parietal cell, G cell, and then what are the factors that increase basically the acid secretion, and what is the potent inhibitor. In addition, the somatostatin also, you know, decrease the secretion of the gastric acid, but this is more significant, prostaglandin, and it's blocked by NSAIDs. And then intrinsic factor is basically produced by your parietal cells, and destruction of these parietal cells lead to deficiency of the intrinsic factor, and secondary deficiency there will be vitamin B12, and this type of anemia is called as pernicious anemia. Thank you.